Hi again. Welcome back to Novel You New series. We are going to have more question and answer with the new series regarding neuromodulator. Here is Jackie.
Okay, Dr. News, I am so excited. My son has a special event coming up. I know. And it's a wedding, and I want my face to have a nice, rested, refreshed look. How long do I need to it? Do we have any time?
Okay, don't wait till the last moment. I come here and say, fix me quickly. So for a quick fix, you're talking about a quick fix, and all I have to offer would be Botox and filler, correct? So Botox is a very common name for the type of medication called neuromodulator. Basically, they're relaxing your muscle function to look more refreshed, correct? We have 5 different neuromodulator available in US market currently. Botox is the most well-known, one, but we have Dysport, we have Juvo, we have Xyamine, and we have Daxxify. Each of them, can work a little bit differently than different person, and depends on. So we can always evaluate you and see which of them would be the best product for your beautiful face. But just answer your question, if I want to make you ready for your son wedding or for any special events, Botox would be the best and quick fix, let's put it that way, for you to look refreshed. Of course, we have fillers, but right now we're talking about the neuromodulator. So routinely on my consultation day, I would look at your face as we always do. These neuromodulator can work on 2 different parts of the face. So studies and FDA approval has been made based on upper face, but now we get more and more of the lower face correction with neuromodulator too. So talking about the upper face, Frown Lines always, would be the first approach for your face not to look angry. And of course, we have cross feet that can be touched with the Botox, product, and your frontalis muscle. So these are the upper face if I want to talk about, refreshment. And the lower face, we can have the marionette line to be addressed with the Botox just to give you a happier face if you have some kind of like sad look on the lower part. The most exciting part about the lower face is your jawline and the platysma band. So basically, with addressing the platysma band, your face is going to be uplifted, so it looks even more refreshed. And of course, that is going to affect the necklines, and you look even more tightened on your necks. It's well known as a Nefertiti, treatment, but it's basically Botox for your lower face. So marionette line, your jawline, your platysma band could be addressed in this treatment. If we want to go a little bit further, if we want to slim your face, definitely Botox can work on your masseter. I don't advocate this treatment for a long time at all because it's going to affect your chewing muscle. But again, for just purpose of one event, we can do a lot for your face with Botox to be refreshed.
So what kind of timeline ideally would you like to use?
If you remember, I always say you need to give 2 weeks for any kind of Botox product to settle and make a very good symmetry in your face. But if you're making yourself ready for an event, I would always say give yourself at least a month, because we want to make sure that if there any correction needed, we still have time. So 2 weeks for the initial treatment to settle, and then again, if we need a little bit touch up here and there, we have another 2 weeks. So a month would be perfect if you plan for your Botox treatment prior to any event. Are you ready?
Getting there.
Anything else that you would like to know regarding the different Botox?
You mentioned that there's Botox, and I know that that is a name of a product, but it's all neurotoxins. What are the others?
So botulinum toxin A as a main part of these products has been known for a long time, but the difference between the products are the protein or the peptide that this botulinum toxin A is bonding to make them different from each other. So as again you mentioned, the brand Botox has been bonded to a certain size of the protein. We do have Juvo that has been bound to the smaller size of protein. We do have Dysport that has been bound to the larger size of protein, and each of them can make different in your look. So if you're an athlete, you have been exercising, your metabolism is high, we might offer Dysport on you because the larger protein can actually settle better in those muscles that are very active. If you're not on that category and you're looking for more of the natural look and your metabolism is normal, we would offer Juvo on you because it has the smaller protein size. So that's what I love. I love Juvo. I'm not an athlete, unfortunately, so I am very comfortable with Juvo look. It makes you look very natural. You still keep your movement. It doesn't freeze your face, so that's my choice, correct? And then we have Xyamine and Daxxify. These are both attached to the peptides. So for those people that are not responding to Juvo, Botox, or Dysport, we have an option with different categories. So not protein-based, but peptide-based, correct? So we are using these two products for those that are showing some resistance to the protein-based products. So, and again, they can be differentiated with the time that they're staying in your body. So Daxxify is well known for the longer acting, effect of it, correct? And Xyamine is not that longer acting, but it still is peptide-based. So this is how we differentiate this product from each other.
So let's say that, and you know me, in addition to this big special event coming up, I'm also out in the public talking with people, and I just want to maintain a really good natural look that is very relaxed and very me. So would you use different products then for different purposes?
So if you're talking about neuromodulator, I always recommend my patient to stay in one and don't keep changing them from each other. If you respond very well with one product, there is no need to go to another product, correct? But if we come out of neuromodulator and talking about how to preserve your natural beauty, we can always talk about our RF microneedling, collagen boosting, talking about the sculpture as another alternative for your collagen boosting and skin tightening. And as you do these longer acting modalities to create your own collagen, then your body doesn't even need Botox that often, correct? So you're making your skin go back 20 years younger. So just like a 20-25 year that making all these features, creating all this line, but then recoiling very fast, and they do not have a static line, your face wouldn't even need them. For you that you're watching us today, please write your question if there is further question in this matter. We have a blog. That link is going to be underneath this YouTube video, so you can always click on that and learn more, and stay tuned, we have more to discuss.